Welcome to my channel Medicine Guide. Tamiflu Oseltamivir is an antiviral medication that's a go-to choice for treating the flu. It's generally well tolerated with mild side effects for most people. Common Tamiflu side effects include nausea, vomiting, and diarrhea. Nausea is more common in people ages 13 years and older. Vomiting is more common for kids ages 1 to 12 years old. And diarrhea is more common for infants. Serious Tamiflu side effects include mental health changes in children and severe skin reactions. These side effects are rare but may require urgent medical care. If you've recently come down with the flu, there's a chance a healthcare professional may have prescribed you medication to treat it. One common flu medication is Tamiflu Oseltamivir. But what is Tamiflu, and is it safe? This antiviral medication is often the first choice when the flu strikes, since it's considered safe for many people. Even infants and pregnant women can take Tamiflu if needed. But as with all medications, Tamiflu can cause side effects. Most people tolerate the medication well. Still, it's important to know what to expect should you need to take it. Tamiflu Oseltamivir. Side effects at a glance. Most Tamiflu side effects are mild and resolve on their own after you finish taking it. In fact, many people experience no side effects from it at all. Common Tamiflu side effects, those happening to at least 1% of people taking it, include nausea, vomiting, diarrhea, diaper rash in infants, headache, muscle pain. Rare but serious Tamiflu side effects include mental health changes in children, severe skin reactions. We'll review 6 of these Tamiflu side effects in more detail, plus a few other common Tamiflu questions. 1. Nausea. Nausea can happen with a lot of medications. In clinical trials, up to 10% of people ages 13 and older taking Tamiflu reported this side effect. Taking your doses with food can help lessen this feeling. Staying well hydrated, eating smaller meals, and avoiding greasy or spicy foods are also good tips for nausea relief. 2. Vomiting. For many people, Tamiflu can also cause vomiting. However, this side effect seems to be more common in children than in adolescents or adults. In studies, about 8% of people ages 13 and older taking Tamiflu reported throwing up. But this rate doubled in children between 1 year and 12 years of age. As many as 16% of them experienced vomiting. Taking Tamiflu with food, as well as following the above tips for managing nausea, can also help prevent vomiting. But if you throw up shortly after taking it, contact your healthcare team. Depending on how long it's been since your dose, you may need to take it again. 3. Diarrhea. Diarrhea is defined as 3 or more watery stools per day, and many medications list it as a side effect. Diarrhea with Tamiflu isn't common for adults and most children. But it did happen in 7% of infants under a year old during Tamiflu's clinical trials. About the same percentage of babies also experienced diaper rash. Typically, loose stools caused by Tamiflu should stop after finishing the medication. But diarrhea in infants can lead to dehydration more easily than in adults. If you notice any unusual changes in your infant's stool consistency after they start Tamiflu, contact their pediatrician. 4. Headache. Headache is another possible Tamiflu side effect. Between 2% and 17% of clinical trial participants ages 13 and older reported this side effect. It's important to note that a similar number of people taking placebo, a pill with no medication in it, also experienced headaches during these studies. This is likely because headaches are a common symptom of the flu. If needed, you can take over-the-counter, OTC, pain relievers to help with headaches while taking Tamiflu. Popular options include acetaminophen, Tylenol, and ibuprofen, Advil, Motrin. Neither interact with Tamiflu. Just be careful if you're taking them with any OTC flu medications. Many of these products already include a pain reliever in them. You may also want to ask a healthcare professional if it's safe for you to take OTC pain relievers. These medications aren't right for everyone and come with their own unique risks and side effects. 5. Mental health changes in children. In the early 2000s, Japanese health officials reported that some children taking Tamiflu experienced mental health side effects. These included hallucinations, confusion, and behavior changes. There were also rare reports of deaths linked to these side effects. Experts aren't sure why this trend was seen almost exclusively in Japan. Out of caution, it's recommended to monitor your child while they're taking Tamiflu. If you notice any sudden changes in their mood or behavior, contact their pediatrician right away. 6. Serious skin reactions. Rarely, people taking Tamiflu have reported serious skin reactions. These reactions can be life-threatening, especially if left untreated. Examples include Stevens-Johnson syndrome and toxic epidermal necrolysis. If you experience a rash, blisters, or skin peeling while taking Tamiflu or within 3 weeks after taking it, seek medical care. These skin reactions are considered an emergency and need immediate treatment. The bottom line: Tamiflu, Oseltamivir, is a commonly prescribed flu medication. While well tolerated, it can cause nausea, vomiting, and diarrhea for some people. Nausea is more common in people ages 13 years and older. Vomiting is more common for children ages 1 to 12 years old. And infants are more likely to have diarrhea, which can lead to diaper rash. Most Tamiflu side effects should go away after finishing the medication. But if you notice anything severe or out of the ordinary, contact your healthcare team. They can let you know if further care is needed. Now let's have a look on uses of Tamiflu, Oseltamivir. Uses. Oseltamivir is used to treat symptoms caused by the flu virus, influenza. It helps make the symptoms, such as stuffy nose, cough, sore throat, fever, chills, aches, tiredness, less severe and shortens the recovery time by 1 to 2 days. This medication may also be used to prevent the flu if you have been exposed to someone who already has the flu, such as a sick household member, or if there is a flu outbreak in the community. Talk to your doctor for more details. This medication works by stopping the flu virus from growing. It is not a substitute for the flu vaccine. How to use Oseltamivir Phosphate. Take this medication by mouth with or without food. You may take it with food or milk to minimize stomach upset. Take this medication as soon as flu symptoms appear or as soon as possible after you have been exposed to the flu. Oseltamivir works best if you start taking it within 2 days of either of these events. If you have the flu, take Oseltamivir as directed by your doctor. usually twice a day for 5 days. To prevent the flu, take oseltamivir as directed by your doctor, usually once a day for at least 10 days. The dosage is based on your medical condition and response to treatment. In children, the dosage is also based on weight. If you cannot swallow the capsules, ask your doctor or pharmacist about the liquid suspension form of oseltamivir. If the liquid is not available and if directed by your doctor or pharmacist, you may open up the capsule and mix the contents with a small amount of sweetened liquid, such as regular, sugar-free chocolate syrup, corn syrup, caramel topping, or light brown sugar dissolved in water. Stir the mixture and take the entire dose. For the best effect, take this medication at evenly spaced times. That's enough for this video. For a detailed information on medicines, please keep watching my channel. Disclaimer: channel's intention is to make sure that its consumers get information that is accurate, reviewed by an expert and error-free. However, the information mentioned here should not be used as a replacement for the advice of a qualified physician. The information given here is for informational purposes only, which may not cover all possible precautions, side effects, contraindications or drug interactions. Consult your doctor and discuss your queries related to any medicine or disease. Thank you for watching the video. Please do not forget to like, share and subscribe to my channel Medicine Guide.